Welcome back. You're watching McLaren Port Huron's Today's Health, and in this part of our program we're talking with the stroke coordinator at McLaren Port Huron, and her name is Stephanie McLaren. Stephanie, welcome to our program.
Hi Barb, thanks for having me.
I understand that McLaren Port Huron has recently recertified as a primary stroke center. Can you tell me about that?
Yep, we got recertified in March through Joint Commission, which is our regulatory accreditation. They came in for a one-day survey where they looked at all our policies, protocols, our whole stroke program, and went over what we're doing really well. And from getting certification, that gives our patients evidence-based care when they come to McLaren Port Huron for stroke care.
And tell me what you mean by evidence-based care.
So we have guidelines through American Heart and American Stroke Associations that we follow, providing our patients with the most up-to-date best practice care in stroke treatment.
So when you have a certification, that means patients can count on
Yes.
that you're going to follow those.
Yep, that every stroke patient gets this care when they come here.
Tell me a little bit about your responsibilities.
As a stroke coordinator, I work with education to provide staff with education, any staff, whether it be maintenance, housekeeping, nurses, nurse aides, they all get stroke education. So then they know how to respond to a patient having a stroke, whether it be calling a code stroke or recognizing a patient, a visitor, or another staff member having stroke symptoms. I also work with the families and the patient on their stroke education to prevent them from having a stroke reoccurring. And then I also oversee any policies, protocols, or order sets that we have.
Sounds like you do a lot of organization and keep everything running very smoothly according to a plan.
Yes.
So that's what the stroke coordinator does.
Yes.
Okay. Can you remind us, because it's so important, what the symptoms of stroke are?
Yep, we use Act Fast, and you may have seen this. It's a very popular stroke recognition for signs and symptoms. And the F is for face, so we look for a facial droop. The A is for arms, but we say arms, legs, numbness, weakness in those extremities. S is for speech, so whether it's slurred or anything different from what the patient's used to. And then T is the biggest one, and it's for time, and it's to call 911 to get to the hospital in a fast, effective way.
Well, that's my next question is, why is it important to call 911 when you think you're having a stroke?
It's a good question. To get here in priority time is very important to decrease your risk of disability or even death. For every minute a patient leaves untreated stroke symptoms is 1.9 neurons are destroyed, and for every hour it's left untreated, their brain can age 3.6 years. So we really encourage that time factor. We also have a medication called TPA, which is a clot dissolving medication we use for stroke. If the symptoms are within 3 hours and the patient gets here, we look at criteria. We do a brain CT to make sure there's not any bleeding, and you can qualify for this medication. And this medication really decreases disability in a stroke patient.
What happens when a patient arrives in the emergency center?
There's fast action. Whether you come in by EMS or you come in through the front door, you're getting brought straight back to a room. You may be taken right to CAT scan to get a scan of your brain. So it's very fast. You have the physician in the room, you have the nurse in the room. They're doing a stroke scale, starting an IV, drawing lab work, checking the heart monitor. So it's very fast. They're looking at whether or not you're a candidate for this medication called TPA. So in all reality, you just, when you get here, be prepared for a lot of people, but they're all looking to give you the best care possible.
Because of that whole time is so important to the outcome. How important is it for a patient who's had a stroke to manage their risks, and how do they do that?
The risk factors are huge. Once you've had a stroke, you're really at risk to have another stroke, even if you've had what's called a TIA or a mini stroke. So you really want to know your risk factors. Know your blood pressure and make sure it's under control. You want it to be 120/80 or lower, and you want to get that checked by your physician at least yearly. Your cholesterol is another risk factor you want to get checked. If you have atrial fibrillation, which is an irregular heartbeat, that's a big risk factor for stroke. So knowing if you have that really prevents you from having a stroke or another stroke. Not using excessive alcohol, stop smoking, and just getting out and being more active and changing your lifestyle. If you have diabetes, knowing that is monitored and you are in therapeutic range with that.
Do you have resources available to people that might be watching to think, oh my gosh, I can't get this all down? What could they do?
Yeah, we do. We actually have a bi-monthly stroke support group, and it's not just for stroke survivors, it's for any mental status, any neurological deficit. We also have our smoking cessation with our 55 plus program through community education. There's diabetes education that's outpatient. So there is a lot of resources here at McLaren Port Huron.
What would you like all of our viewers to know?
To be aware of what the signs and symptoms of stroke are, know what your risk factors are that could predispose you to having a stroke, and just know that no matter if you think you're having a stroke or it's a mini stroke or TIA, to get to the hospital and seek care.
Thank you so much.
Thank you.
And thank you for joining us. We've given you a lot of important information today. If you have any questions about anything we talked about, if you want a copy of this program, call us at Health Access. That's 1-800-228-1484. You know, our website is just a really great resource. And you can go there, and that is mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.